Section 5. Biological therapies. Conventional antipsychotics. One of the most commonly prescribed drugs, phenothiazine, is related to the antihistamine drugs used to treat common cold and asthma. A phenothiazine derivative, chlorphrazamine, trade names thorazine or large actyl, was found to be very effective in reducing the symptoms of people with schizophrenia. The conventional antipsychotic drugs work by blocking the effects of dopamine and, as a result, reducing the symptoms of schizophrenia. They are dopamine antagonists in that they bind to the dopamine receptors, especially the D2 receptors, but do not stimulate them, thus blocking their action. By reducing the stimulation of the dopamine receptors, antipsychotic drugs can reduce the acute positive symptoms of schizophrenia, hallucinations and delusions. Evaluation, effectiveness. Positive Symptoms, Julian, 2005, found that conventional antipsychotic drugs are the most common form of treatment for people with schizophrenia and are effective for 70% of people. These drugs reduce many of the positive symptoms of schizophrenia. They decrease the average length of time a person is hospitalized. This enables patients to live a relatively normal life in the community, and schizophrenia has changed from a long stay to a short stay condition. This would suggest drugs are an effective treatment. Issues with effectiveness. Wide range of symptoms. Schizophrenia is a condition with a wide range of symptoms, as shown above. Treatments may be effective for some patients but not for others. A substantial proportion of people with chronic schizophrenia cannot be helped with conventional antipsychotic medication. Problems with measuring effectiveness. When to measure. Schizophrenia is an episodic disorder, and there may be periods when the patient is symptom-free, but this does not mean they no longer have schizophrenia. Placebo effects. A further problem with measuring effectiveness is that some patients might get better simply because they are receiving attention from a therapist rather than benefiting from specific therapy. This could be overcome by having a control group, for example a group of patients on a waiting list for treatment. Evaluation, appropriateness, side effects. There are some serious side effects related to antipsychotic drugs. Between 20% and 25% of sufferers who take the drugs will suffer from some form of disordered motor movements, like tremors and involuntary tics, tardive dyskinesia. These and other symptoms are the reason why many sufferers, approximately 50%, stop taking drugs within the first year. So these are not an appropriate treatment. They cause harm, and people with schizophrenia prefer not to take them. Atypical antipsychotics. These are a range of drugs which are as effective in controlling the symptoms of schizophrenia as the conventional antipsychotic drugs, but which seem to avoid some of the problems. Clozapine, for example, appears to be effective in controlling the positive symptoms of schizophrenia, particularly for individuals who are resistant to the phenothiazine. These drugs appear to act by temporarily blocking the D2 receptors, then rapidly dissociating, allowing normal dopamine transmission. This is characteristic that is thought to be responsible for the lower levels of side effects like tardive dyskinesia. They may also act by blocking the serotonin receptors in the brain, but the precise biochemical mechanisms are still not certain. Evaluation, effectiveness, negative symptoms. Research from DeLima et al. 2005 suggests that atypical antipsychotic drugs do seem to improve negative symptoms. This would suggest that atypical antipsychotics are more effective than conventional antipsychotics, as these are not effective in treating the negative symptoms. Evaluation, appropriateness, fewer side effects. These drugs are more appropriate for treating schizophrenia as there are fewer side effects. This is one of the main advantages of the atypical drugs, in that the motor side effects are significantly reduced compared to with the conventional drugs. For example, there is also a lower likelihood of tardive dyskinesia. Jest et al. 1999 demonstrated that with conventional antipsychotic drugs, 30% of patients showed tardive dyskinesia after 9 months of treatment, compared to 5% for those treated with atypical antipsychotics. This means relapse rates would be lower, as sufferers taking these are more likely to persevere with their medication. This suggests atypical antipsychotics may be more appropriate treatment than conventional antipsychotics. Serious side effects. Although there are fewer side effects, they can still be serious. The drugs can affect the immune system and produce a granulocytosis, which lowers the number of white blood cells. This can leave a person vulnerable to infection and may be fatal. With this affecting 1% to 2% of patients, perhaps these are not always the most appropriate choice of treatment. The appropriateness of these drugs is further hindered by the fact that patients must have their blood monitored regularly, which makes the treatment expensive and time-consuming. This is a more important issue for people with schizophrenia living in the community because it takes commitment and time to maintain the correct dosage of atypical psychotropic drugs.